Welcome back, my friends. In our previous video, we explored the thermal properties of dental materials, understanding how temperature changes impact your dental work. Today, we're diving into a crucial aspect of dentistry: adhesion in dental materials. Adhesion is a fundamental concept. It's all about how materials stick together. Think of it as a strong connection between two different things when they touch. This is essential in dentistry because it helps us create strong bonds between dental materials and your teeth. When it comes to sticking things together, we have two key players: adhesives and adherents. Adhesives are the materials that do the sticking, and adherents are the surfaces they're sticking to. Okay? In dentistry, we often need to bond different materials. For example, we might want to connect dentine and gold, or we might need a material to bond with enamel or dentine. There are two ways adhesion happens: mechanical attachment and chemical adhesion. In mechanical attachment, think of the adhesive fitting into nooks and crannies in the surface of the material, like puzzle pieces coming together. This is especially important in retaining the dental fillings. In chemical adhesion, it's more like a chemical attraction. The adhesive and the surface it's bonding to have a special connection. This can result in a strong bond, like glue, that's hard to pull apart. No matter how they bond, adhesives must wet the surface they're sticking to. This means they need to spread out and touch the surface to form a strong bond. To check if an adhesive is good at wetting, we look at the contact angle. A low contact angle, ideally close to 0, means the adhesive is spreading well. High contact angles mean poor wetting, and that's not where we want to go. Surface tension is what keeps an adhesive in a drop shape. To create a strong bond, we need to break through the surface tension. This is a bit tricky because many dental resins are hydrophobic, while teeth are moist. Here's where the primers come to the rescue. They change the surface of the tooth, making it easier for dental materials to bond. Think of them as matchmakers for adhesive relationships. For a strong bond, the adhesive and adherent should be in contact over a large area. This means adhesives should be applied as low viscosity fluids or paste so that they could flow all over the surface. When two rigid surfaces meet, there's often limited contact because they're not perfectly flat. This means the actual area of contact is smaller than it seems. Now, picture a situation where a fluid adhesive is spreading nicely across the surface. This ideal scenario ensures good bonding because the adhesive and surface takes full advantage of adhesive forces. In dental terms, this concept matters a lot. When we apply adhesives, we want them to spread well and bond effectively, ensuring dental work stays in place. Imagine applying adhesive to etched enamel. In some cases, the adhesive might not adapt well, but with a low viscosity adhesive that wets the surface properly, it can adapt and bond effectively. So that's adhesion in dental materials in a nutshell. It's the secret to keeping your dental work in place, ensuring your beautiful smiles last longer. If you found this information helpful, don't forget to like and subscribe for more insights into the world of dental materials. Until next time, keep smiling.